To another section of this course, mental health management. We are closer to the end of the module. This is module 9, which implies that we only have one more module to round this course, to round it up. This is module 9, and the topic that we'll be looking at, that we'll be treating in this module is mental health laws in USA, Canada, and Nigeria. So we have to consider these different laws in these different countries so that we can easily be exposed and be able to relate to mental health laws when we are talking about mental health in different territory or different countries. And do not forget, we've been able to justify this course efficiently if you are following the course, the class very well. So we have introduced ourselves to mental health management. We've talked about the history. We've talked about the do's and don'ts in mental health management, roles and responsibilities, and the likes. We will also be talking about building mental health strengths. That will be in the next module 10, and that will be our last topic for this course. So let's go back to the main subject of the day, which is mental health laws in USA, Canada, and Nigeria. We have the content of the module to be one. We'll be looking at mental health laws in the United States. That's one. Then we'll also look at the challenges facing mental health laws in the United States. Then after that, we'll move on to the mental health laws in Canada, and also address the challenges facing mental health laws in Canada. And finally, we'll be looking at mental health laws in Nigeria, as well as looking at the challenges facing mental health laws in Nigeria. So if you follow these subtopics very well, you see that we are trying to express or expose us to different mental health laws in different countries, as well as the challenges that each countries are facing when we are talking about mental health laws, the kind of challenges that they are facing in their country differently. It is different territory, different countries, different orientation, different culture, and the likes. But we will also be looking at these challenges so that it will be easy for us as a learner to understand these laws and the kind of challenges that they are facing in these different countries, even without being there. So now let's move to the introduction of the module, to the course, to the topic. Sorry, we have that mental health laws. It encompasses legal frameworks that govern the rights, treatment, and protection of individuals with mental health conditions, including provisions for involuntary commitment, access to care, anti-discrimination measures, and integration into broader healthcare systems. So these laws vary significantly across countries due to differences in federal structures, cultural attitudes toward mental health, and historical context. Let's take in the United States, for instance. Mental health laws are shaped by a mix of federal statutes and state variations, emphasizing priority in insurance coverage and crisis response amid ongoing policy shifts. Now, let me quickly address or explain that. We have it that just like we have read it in this introduction, mental health laws, it is just it revolves around it is a framework, but a legal framework that is governing the rights and protection of individuals with mental health conditions. This is just a layman definition that we can easily understand. It has to do with legal frameworks that is guiding or governing the rights and protection of individuals with mental health conditions. So now this individual could now come in different form. It could be a child, it could be an elderly person, it could be a man, it could be a woman, it could be a girl, a boy, or what have you. So now, if we take notice, we have it that these laws, they vary significantly, and very significantly they vary. So it's different, it is different, and these things depending on each countries and jurisdiction. So it varies across countries due to differences, just like we are trying to explain here, that due to differences in federal structure. We have different federal structure. The way the governmental structure in Nigeria is quite different from what we have in France or other countries like that, or Burkina Faso, or in US, in Canada. Let's take Canada. Yes, in Nigeria and Canada, although the US and Nigeria might want to be similar, but there are still differences. Now, due to these differences in federal structure, cultural attitudes. There is also the trace to cultural backgrounds toward mental health and historical context. This is why these laws they vary significantly. Now let's move on to the mental health. Let's move on to mental health laws in the United States now. Now, the United States of America, it operates a complex system. I said it operates a complex system of mental health laws, and these that are primarily governed at the state level with significant federal oversight to ensure consistency in rights, in funding, and access to care. Now, federal legislation such as the Mental Health Parity and Addiction Equity Act, that's MHPEA of 2008, they mandate that health insurance plans treat mental health and substance use disorder on par with physical health conditions, and they also prohibit discriminatory practices in coverage limits or cost. This framework is supplemented by the Affordable Care Act, that's the ACA of 2010, which expanded mental health coverage through essential health benefits requirements for marketplace plans and Medicaid expansions in participating states. Now, as of recently, that is 2026/2025, 2025/2026, sorry, the ongoing reforms emphasize integrating behavioral health into primary care with the Substance Abuse and Mental Health Services Administration, that's the SAMHSA, SAMHSA. They are playing a central and important role in administering grants and programs aimed at prevention, treatment, and recovery support. This is just we trying to introduce to us the different way in which the United States of America operates when we are talking about media health services or media health laws into people with vulnerable or people with people with mental health in the country, by offering different kind of support and administering grants and all. So let's look at the challenges facing mental health laws in the United States. One of the foremost challenges that is confronting mental health laws in the United States as of recent is the persistent threat of federal funding cuts. That is the federal funding cuts, which excavate existing shortages in resources for behavioral health programs and services. The FY 2026 president, that's the final 2026 president's budget, request and propose substantial reduction to agencies involved in mental health and substance use, potentially slashing support for essential initiatives like crisis intervention and community-based care, which are already strained post-pandemic. Now, this comes amid in the middle of warnings from advocacy groups that such austerity measures would worsen the mental health crisis, particularly in underserved areas where Medicaid funded programs from the backbone of treatment access. For instance, early 2025 debates in Congress highlighted how budget constraints have begun impacting behavioral health, with providers facing reduced reimbursement and program closures, leading to longer wait times and also unaddressed needs among vulnerable populations such as low-income families and rural communities. Now we move on to mental health laws in Canada. Now, mental health law in Canada can be said or a decentralized one, with primarily responsibility falling to provinces and territory under the Canada Health Act (CHA) of 1984. And this also provides and establish principles for publicly funding healthcare, but it does not explicitly include mental health services as insured benefits. This results in variations in coverage, where hospital-based psychiatric care is universally covered, but community-based therapies and medication often require private insurance or out-of-pocket payments. The federal government influences through funding transfer and national strategies, such as the Mental Health Strategy for Canada, developed by the Mental Health Commission of Canada (MHCC), which advocates for a recovery-oriented system emphasizing prevention, early intervention, and stigma reduction. Now, as of 2026, proposals like Bill C-201 seek to amend the CHA, that is the Canada Health Act, to incorporate mental health addictions. So to incorporate mental health addictions and substance use services as insured health services, aiming to bridge gaps in access. Now we have the challenges facing mental health laws in Canada. The different challenges. We can't talk about all countries have their own problem or some kind of challenge that they are facing when it comes to these things. Now, a primary challenge to mental health laws in Canada as of recent is the ongoing constitutional and human rights scrutiny of provincial mental health acts. Sorry about that. And it is particularly concerning involuntary detention and treatment provisions that may infringe on individual autonomy. In British Columbia, a long-standing charter challenge to the Mental Health Act heard in Supreme Court starting in 2025. It questions the broad powers allowing detention without sufficient safeguards, arguing violations of rights under the Canadian Charter of Rights and Freedoms. We have similar concerns that also arose with Bill 32, where we have the Mental Health Amendment Act number 2 of 2025, and this which aimed to empower nurses but created confusion around rights protection and access to quality care, prompting calls for comprehensive reforms from groups like the Council of Canadians with Disabilities. These litigations underscores broader issues in balancing public safety with dignity, as outdated laws fail to incorporate modern principles of recovery and least restriction, leading to potential abuses and prolonged legal battles that strain resources. Now, let's move to the mental health laws in Nigeria. So, in Nigeria, mental health laws have significantly evolved from colonial era legislation to the modern frameworks, that is, modern legal frameworks, which begins with the Lunacy Ordinance of 1916, revised at the Lunacy Act of 1958, which emphasized custodial care and granted broad powers for detention, but was later criticized for stigmatizing language and human rights shortcomings. These outdated acts persisted until the National Mental Health Act of 2021, which was signed into law on January 5, 2023, marking a pivotal shift towards rights-based, community-oriented care. Now, as of recent, as this was this year, 2026, the new act discriminalizes mental health issues, prohibits training and other abusive practices, and also integrates mental health into primary health care systems. The National Mental Health Act 2021 establishes key provisions, including the creation of a National Mental Health Fund for resource allocation, a Department of Mental Health in the Federal Ministry of Health, and guidelines for involuntary admissions limited to emergencies with judicial oversight. These are the different changes that we can see over the years at mental health laws when we are talking about mental health laws in Nigeria. Let's move on to the challenges facing mental health laws now in Nigeria. Now we have that in the implementation of Nigeria National Mental Health of Nigeria's National Mental Health Act of 2021. It remains a core challenge as of 2026, that is recently, which significant delays in operationalizing its provisions due to inadequate infrastructure, inadequate funding, and regulatory frameworks. Signed into law in 2023, the Act aims to decriminalize mental health issues and integrate services into primary care, yet progress is hampered by a lack of dedicated resources, leading to continued reliance on outdated practices like training in some regions. A critical review of this policy highlights how its impact on youth demographics is limited by poor enforcement, with only partial advancement in establishing a national mental health fund and departmental structures within the Federal Ministry of Health. So this sluggish rollout perpetuates human rights violations under the lingering influence of the colonial era Lunacy Act, underscoring the need for urgent action to align with international standards like the UNCRPD. Thank you. This will be the end for this module. Sorry about that. We are now finally, I forgot. Let's conclude. In conclusion, we have that mental health laws in the United States, in Canada, and Nigeria has been able to reflect a complex interplay of federal and provincial or state regulations, also the cultural attitudes and historical context. While the US emphasizes parity in insurance coverage and crisis response, Canada, on the other hand, focuses on universal access and provincial mental health acts. Now, Nigeria's recent National Mental Health Act 2021 also marks a significant shift towards rights-based care, but implementation challenges persist. Common themes include workforce shortages. These are the common challenges that we could easily see in the tree. Commons it includes workforce shortages, funding constraints, and stigma, underscoring the need for cohesive reforms to ensure accessible, equitable mental health care. Thank you. That will be the end for